Well, hello everyone. Hello, and welcome. Today's session is about overdose prevention and intervention. Facts about the drug crisis. Yes, we are currently in a drug crisis. And we want to talk about prevention. Prevention is a definition of stopping it from happening. And intervention also stops it from happening, but you want to intervene before it happens. So we want to talk about overdose prevention. This is a pretty sensitive subject, but we're going to make it through. It's sensitive because some of us have been affected directly or indirectly by somebody else's drug use. So let's get started. Like I said, I'll be your facilitator today. My name is Dr. Yolanda Young Simmons. And our topic today is part of our staff development series. And we have this series because our goal is to serve people better. We operate as a team, but we also operate as service to others. And our training encourages the employees or to staff or personal development to enhance your knowledge and to boost your productivity and morale. And so, but at the end result, we're going to serve people better. I said, beware, beware. After surgery, that's a picture of a hospital because after surgery, certain prescription drugs like opiates can lead to addiction. They will prescribe these drugs as painkillers. Sometimes you take a pain medicine before surgery to relieve the anxiety, and sometimes after surgery, you relieve the anxiety. But I want you to be aware that even when you go to the hospital and under a licensed physician, they may prescribe to you a medication that can lead to addiction. We had some celebrities that was under doctor's care. We had that died from overdose of some type of medical prescribed prescription. We had Michael Jackson, we had Prince, and it was told that a day before he passed away, he was at the doctor's office, maybe picking up a medication of some sort. We really don't know. But what we do know is that we have to be aware that when you go into surgeries, these prescriptions can lead to a long-term dependence, the dependence towards addiction. And patient will be subscribed it for surgery, before surgery, after surgery, and then a year later they're still taking a chronic pain pill and it becomes addicted to them. So just be aware and just say no to drugs. That's what who was that? Ronald Reagan's wife said, "Say no to drugs." I thought that was a real simple solution to a big drug problem, but it is very effective. You can say no. No, I don't want that type of medication. Because after surgery, those prescription drugs, it can look in different phases and look all legit, but it may not be the best for you. So, overdose and prevention and intervention is very important because we want to realize that fentanyl remains one of the deadliest threats that we have in U.S. today. Let me tell you a little history about fentanyl. Fentanyl was developed by Paul Jensen. He was a Belgian scientist, a physician, from Belgium. And him and a team developed fentanyl, and they worked very hard to have a painkiller that would be more effective than morphine. And now they did. They were successful. They still have Jensen Pharmaceutical Company, and I'm quite sure they have billions of dollars. All the pharmaceutical companies make billions of dollars off prescription drugs. But the fentanyl, it was originally developed as pain management for surgical procedure in severe pain cases, but after a while, it became the legal illicit production of the fentanyl that we have a problem with. Fentanyl is very powerful, 50 to 100 times more potent than morphine. And I just think one of the dangers is that we have it in our community and we can't stop it. We can't stop it. It continues to widespread. It's developed in 1960 by Paul Jensen for pain relief. It used the medical anesthesia and cancer pain relief, 100 times more potent, and became illicit production in 1990. And there's a crisis. There's a crisis here. Over 70,000 overdose deaths due to fentanyl. in 2021. And in 2020 is when we had COVID. So fentanyl just snuck in under the wire, unbeknownst to us that it was becoming a very dangerous drug. And it really is. It's dangerous because it's easily accessible and they have counterfeit pills, meaning that you may think you're taking a Vicodin with a V on it. I don't know if Vicodin has a V on it. I'm just telling you counterfeit pills. They look a certain way. The doctor shows you, or you can see a picture of the pill and it has a V on it. Then you have another pill that has a V on it and it's really not Vicodin. It could be a counterfeit um, fentanyl pill. And so that's one of the reasons there's a crisis here. International drug trafficking plays a major role in the crisis because it first appeared in 2000 and now it's mixed with heroin and cocaine. I mean, it is just a messy mess. It's a mess that this product could travel so quickly in our community. And we need to be aware of the dangers of fentanyl. And there's a current crisis in Los Angeles. We are just right there. It impacts vulnerable populations like the homeless community, the underprivileged community, the people that may get a pill from somebody that's not a prescribed physician. They may get a pill because they think they're going to a party. They said ages 15 to 23 overdose from a fentanyl laced prescription pill. It is impossible to tell the difference from the naked eye. It looks just like the real deal. And so, since you cannot tell what fentanyl is and how it travels, it really affects a lot of the homeless population. And it has been effective between 2019 and 2020. The death rate has increased in homelessness 55%. 55%, with fentanyl being a significant contributor to that. And one of the reasons it's in Los Angeles is because the pill is manufactured in China and then it's sent over to Mexico, and we're just neighboring communities in Mexico. They can just come right across the border to get it to the United States through Los Angeles. The Los Angeles area is easily accessible. So I want you to be aware that there's a current crisis about fentanyl in all that we do. And some of it could be because the clinicians are prescribing this ineffectively. There's overdose strategies. If you know somebody, there's a solution to this overdose that we have in this major influx. Public education. If we educate ourselves on the fact, or educate our young people, educate our older people. I think about senior citizens that may have surgery. They may go into surgery for, hip replacement, knee replacement, and they prescribe these drugs. As long as they know what they're getting, they know what they're going for, or they can just say no to drugs. If they can't say no, then maybe they'll have it would be nice if our country had or our state or our community had a process where you take this for a week and now I'm prescribing this and I can't give you any more. And now I'm taking it from a fentanyl to a morphine, from a morphine to a Motrin, from a Motrin to a Tylenol, from a Tylenol to an aspirin, and then you're no longer addicted. I mean, we just need a formula. We need somebody. But because I believe, and I may be wrong, this is a multi-million-dollar industry. Pharmaceutical companies, they make money off your pain. And we don't want them to make money off your pain. We don't want them to make money off your deaths. We don't want them to. So we have to become knowledgeable and aware. So you can have a Narcan, which is a nasal spray. If somebody overdose and you feel that might be related to an overdose, and they sell the Narcan right over the counter. So, and it's not too expensive to have some handy in your home or in your community or wherever you work. And then you spray it under the nostril, you call 911, have a direction to help somebody. Educate them. Narcan, and also have access to treatment. If you know somebody is on drugs and alcohol or related drug or opium, then maybe they have a medication assisted treatment counseling, and they have a program where they go to where they don't have to buy this drug on the street. So you may have a multifaceted approach to prevention strategies for overdose, because you have to have a strategy. Doing nothing is something that you're doing, which means nothing. So we want to combat this situation and not remain asleep about it. But I think public education is key, where we educate our young people, we educate our older people, and we continue to educate people about the disease of addiction and how opiate addiction is rapidly growing and affecting our community. And it's kind of interesting that this the physician scientist that developed this, he died at age 77. Undisclosed death. They won't even say how he died. I just have a theory, whether it's wrong or right. My theory is, if he was affected by a drug overdose, they don't want to lose their money in Janssen Pharmaceutical, so they'll never say how he died. So we don't know. If he died of a heart attack, they could have just easily say died of a heart attack. They could have said what he died from, but it's undisclosed death. Undisclosed. And he's a scientist. He couldn't take a pill for that? Okay. Anyway, so that's just my opinion, that you can put a footnote in that. But my goal is that we will educate the population and that we will become aware that we need to do something. There's a call to action that we must have, a call to action. We must take action by educating, supporting the policies and prevent overdose, and also life-threatening diseases, or they may become addicted, but it was innocent. They didn't expect to become addicted because they didn't know, and that's why we need education. But together we can save lives and reduce the impact of this epidemic. And I'm calling each and every one of you, whether you're affected directly or indirectly, to stand on the front line and educate our young people, educate our senior citizens, educate our community against the fentanyl crisis that is facing our community today. We could stop this. We could stop this with education and the resources, so that they won't seek after illicit drugs on the street and things of that nature. Okay? Well, in closing, I'd like to thank you for letting me be of service. As I said before, my name is Dr. Yolanda Young Simmons. I believe sincerely in my heart of hearts that each one of us have a calling to serve other people better. And in that mind, God uses ordinary people to do extraordinary things. And you could be that one. You could be that one that's going to do something extraordinary. Can I encourage you today to do something extraordinary, to make our community a better place to live in, to pass the knowledge that you have to others? Well, I'd like to thank you for letting me be of service, and I pray that you would have a great and fantastic day today. Thank you.